Joining us is Dr. Tony Joseph, Director of Trauma and Emergency Clinician at Royal North Shore Hospital. Dr. Joseph, you've said that our public hospital's most pressing need is to get bed occupancy rates down below 85%. Is the picture improving, and what more needs to be done?
I don't think the picture is improving a great deal in New South Wales and indeed across Australia. We know that by OECD standards, Australia has less beds than the OECD standard. We have about 3.6 beds per thousand population, as opposed to OECD of about 4 beds. And in New South Wales, our public hospital beds is less than 3, it's about 2.7 per thousand, because we have a slightly higher number of private hospital beds, which are counted, but really aren't that much involved in the provision of acute care. So while the picture is hopeful because it's now in the public eye, I don't think the number of beds has improved so far.
The Rudd government is committed to health reform, Dr. Joseph, but the interim report of the new National Health and Hospital Reform Commission isn't due until year end. Can patients wait that long, or should Mr. Rudd heed the AMA's call for major funding for more beds in the forthcoming budget?
I don't think that we can afford to wait another 12 months for the report of the National Health and Hospital Reform Commission. I think the matter of providing more beds in public hospitals is urgent, and also there needs to be better coordination between the community services and the public hospital services. This means that the federal government should take over the funding of public hospitals, a matter of urgency, so it can streamline the coordination of care between the community and the public hospitals.
You've also talked about better ways of processing patients. How can patient flow be improved, and in the end, does it not come down to more funding?
More funding will help improve the situation, because the fact of the matter is we know from the 4 years from 2000 to 2004 there was an 8.5 increase in hospital admission rate and an 18% decrease in hospital bed numbers. So we do need more beds because our population is ageing with more chronic disease and more malignancy. When these patients become unwell, they often have no choice but to gain entry to the hospital system through the emergency departments and into the public hospital system there. So there may be ways of better processing patients if we can better coordinate the care between the GPs in the community and the specialists who particularly look after the elderly patients with chronic disease or malignancy, that they may be able to avoid coming through the emergency department but will still need inpatient care, in that they need access to some expensive diagnostic facilities and also often inpatient bed care such as intravenous antibiotics, etc.
As a doctor at the coalface of patient treatment, what's your reaction to the tensions between state and federal governments over health spending and hospital league tables?
I think as a clinician it is somewhat frustrating to be constantly reminded by both state government and federal government that the other one is not spending the money allocated in the manner to which it was intended. It is clear that there is a lack of funding for public hospitals. We know that the previous government provided $3 billion per year as a rebate to the private hospitals. I do not think this is right, and I think that money should be directed into the public hospital system. I think that the extra $1 billion that the Rudd Labor government is promising is a good start, but not nearly enough, and they will need to rapidly up the ante to increase inpatient hospital beds and also senior staffing in our public hospitals, so that we can actually get the right decision made the first time.
Finally, Dr. Joseph, what points will you touch on in your presentation to the Hospital Bed Management Conference in Sydney in May?
I'll be touching on some of the points which have been pertinent to the Australasian College for Emergency Medicine, both Australia-wide and more particularly New South Wales. I'll be discussing the issue of senior staffing, both in emergency departments and in the hospital wards, so that senior staff have early access to patients to make the right decisions the first time. I'll also be discussing the adequacy of hospital inpatient beds, so that there is a capacity to treat. We know that 40% of patients who are admitted to hospitals come through the emergency department. Emergency departments can't do their job unless they have adequate access to inpatient beds. And finally, I'll be discussing there needs to be a change in attitude at state and federal government level, in that they actually listen to clinicians who practice at the coalface and implement their recommendations.
Dr. Joseph, we look forward to seeing you at the conference.
Thank you.